Welcome everyone. Today we're going to tackle a topic that's super common but, not really talked about a lot. Bartholin cysts. The whole idea here is to swap that feeling of uncertainty for some clear, visual understanding.
Okay, so let's just get right to it. That moment of panic when you find a lump down there that wasn't there before. It can be really alarming, right? But honestly, just knowing what you're looking at, that's the first huge step toward feeling in control and getting some peace of mind.
And hey, if this is something you're dealing with, I want you to know you are absolutely not alone. We're talking up to 3% of women will get one of these in their lifetime. That's actually way more common than most people think. So, here's our game plan. We're going to cover what a cyst actually is, how to spot one, the big question of when you need to call a doctor, and then the path to getting better. All right, first things first, let's get down to the basics. What in the world is a Bartholin cyst?
Okay, so it all starts with these little guys called the Bartholin glands. Think of them as two tiny, pea-sized powerhouses. Their main job is to create fluid for lubrication, which, is super important for reproductive health.
The way a cyst forms is actually pretty simple. Imagine a tiny little pipe or duct that carries fluid out of the gland. If that pipe gets clogged, what happens? The fluid has nowhere to go, it backs up, builds up, and boom, the gland swells up into a cyst. It's like a plumbing problem, really.
Okay, so we know what causes it. Now for the really practical part. How do you identify one? There are some super clear visual clues you can look for. Now this is probably the most important thing to get. There's a huge difference between a regular cyst and an infected one, which is called an abscess. A non-infected cyst, it's usually kind of skin-colored, doesn't hurt, feels smooth. But if it gets infected, everything changes. We're talking red, painful, and warm to the touch. That's your body's alarm bell going off, signaling there's a problem. And then there's the size. These can really vary. You might have something as small as a pea that you barely even notice, or it could grow to the size of a grape, a walnut, or even a golf ball. And you can bet that as it gets bigger, so does the discomfort. It can go from, what's that, to, wow, it actually hurts to sit down. The location is another dead giveaway. These things have a pretty specific address. So if you picture the vaginal opening as a clock face, they almost always show up at the 4 o'clock or 8 o'clock position. And another thing, it's usually just on one side, and it feels like it's deeper in the tissue, not just a little bump on the surface of the skin.
Of course, anytime you find a lump, your mind starts racing, right? What if it's something else? That's totally normal. So let's talk about that and rule out a few other things.
One thing people often confuse these with is a sebaceous cyst. But here's the main difference. A Bartholin cyst is deep. A sebaceous cyst is much closer to the surface of the skin, and sometimes you can even see a tiny little dark spot or pore in the middle of it. Okay, we have to talk about the scary stuff for a second. Vulvar cancer is extremely rare, so please hear that first. But it's so important to know the warning signs. We're talking about things that look and feel very different from a cyst, like an irregular shape, something that feels hard and doesn't move, or any kind of open sore or bleeding. Knowing this isn't to scare you, it's to empower you.
This brings us to a really crucial question. When is it okay to handle this at home, and when do you absolutely need to see a doctor? Let's get into the clear signs that tell you it's time to make that call.
All right, these are the visual red flags. You need to be on high alert for these. If it suddenly blows up in size over just a day or two, if it turns a really deep red or even purplish, or if you see red streaks coming away from it, those are not things to wait on. That's your cue to get medical help right away.
And it's not just about what you see, it's about how your whole body feels. If you've got this lump and you also have a fever or the chills, or you just feel sick all over, that's a big deal. It means the infection might be spreading and you definitely need to call your doctor.
Okay, let's move on to the good news, the path to recovery. Because there are really effective ways to deal with this and get you feeling better.
So you've basically got two paths, and it all depends on how severe things are. If it's small and not bothering you, simple things you can do at home like warm soaks, called sitz baths, can sometimes be enough to help it drain on its own. But if it's big, painful, or infected, that's when a doctor steps in. They have some really effective tools, like draining it or using a tiny catheter to get you relief and help keep it from coming back. And honestly, this is the most reassuring part of this whole conversation. No matter what route you take, home care or a doctor's help, the outcome is usually really, really good. With the right treatment, the area almost always heals up completely and gets back to normal in about 4 to 6 weeks.
So, where do we go from here? Now you know what to look for. And knowing what a Bartholin cyst looks and feels like, that's not just trivia, it's power. It's what turns that feeling of, oh my God, what is that, into the confidence to know what's going on with your body, to spot any warning signs, and to take the right next step for your health.